Now the second speaker of today's session will be joining Dr. Elampirai. Dr. Elampirai from Tamil Nadu. She did her BHMS at Government Homeopathic Medical College in Madurai, Tamil Nadu, and MD at the GHMC in Bangalore, Karnataka. She completed MCAH course at the Other Song Academy, now doing her own practice at her hometown. Also a participant in the Gurukul Advanced Homeopathic Practitioner Program at the Other Song Academy. She is going to tell about the constitutional prescription in chronic cases today. I welcome you, ma'am.
Thank you, Priyanka. Good evening, everyone. Today, my topic is constitutional prescription in chronic cases. I feel like everyone know about the constitutional prescription and no need of explanation for that. Even I am trying to find a constitution exact remedy for the patient. I believe in that, and even I am working hard for that. Here I am going to share two cases from which I got lot of confidence, and I felt it is possible to find a exact remedy, and it will shift, it will not only some changes, it will change the patient, it will increase their quality of life. So I'm directly going to the case. My case, first case, 30 years old Mrs. S, female. She studied MTech and worked in software company, but now she's not doing any job, unmarried, from Tamil Nadu, case taking on Jan 2nd, 2022. And her presenting complaints, she came with eruption in her left palm last 1 week, on and off for last 4 years. I explained the detail later, and ulcer in ear on and off from childhood, now that also increased. And her presenting complaints, eruption in left palm last 1 week, after exposure to onion, vegetables, green chili, banana. If she touch or if she cut vegetable during daytime, she get this eruption, but it subsides last 4 years, but this time it become like a eruption and it's spreading also. And slight pus discharge is there, it's very scanty and yellow discharge, thick in consistency, and that eruptions are painful also, and it's spreading. And past history, before she used to get tiny vesicles after exposure to onion, vegetables, green chili, garlic. But if she cuts any vegetable or any onion during daytime, that eruption comes in nighttime, then it disappears next day, but this time it's like increasing. And ulcer in the ear, on and off from childhood, she has this history. Now complaints increased in last 2 weeks, ailments from any kind of earrings if she use, and swelling with pain is there, and slight discharge, clear, watery and offensive discharge is there. Physical generals, desire nothing specific, but aversion to dairy products, thermally chilly patient, appetite good, others perspiration more on face, and her sleep disturbed due to some stress. And past history, same, already I explained, last 4 years she has this history. And her family history, father has asthma, and personal history, she is a non-vegetarian. Her menstrual history is regular and nothing important in there. In obstetric history also, she has 2 kids, daughter 6 years old and younger son 2 years old. And her life space investigation, about childhood, she said she was very quiet child, and she explained about her sibling. Elder brother was there, but he used to emotionally abuse her a lot. She explained the incident. Once her mother told her to wait one place with her brother, but she was like left that location and searching her mother, but after some way they found her. But from that incident, her brother used to tell her, if that day someone kidnapped you, after your rest of your life you will be a beggar. So he teases her like you are a beggar. he teases, but what this girl do, she go and imagine herself as a beggar, and she cry for that. And she was feeling very lonely that time. He did this entirely all her childhood. And at the age of 17, she was studying 12th standard. That time some bike accident happened. So she was the one driving that bike, and her mother was behind her. She died. So that lot of guilt is there. From that incident, she's like feeling very careful to do anything, and she feels lot of guilt. And she used to told her it's a big mistake, and she is not able to forgive her. That guilt is there. And following that, she said she developed lot of that inferiority complex and suffering from a sense of inferiority towards others. She used to be concerned about other people's emotion than hers. And she was, after that she started to study also, more interest in studies. She was be alone and study only, she not mingle with many people. And she has been married for 7 years. They settled in Singapore, but there is a lot of history of sexual abuse. She said she had lot of expectation about husband, but it was like lot of abuse is there. But during that, she suppressed all her anger mostly. She tried to communicate with him, try to explain the emotions, but then there is a lot more abuse only. So she felt no safety with him. She expressed her problem once to her father, but for that her husband got more offended and he abused her even more. And even she said once, I will file a complaint, but that time also there more he brutally beat her. She suffered more. So from that point she started to suppress her emotions. And even childhood, her father also same towards her mother. So she thought it's a marriage life, so she was trying to accept her husband. And during lockdown also, her husband was like not talking to her. He was like hiding from her. Something happened, so she was trying to talk to him. That time he expressed, you are working, that's why I married you, but nowadays you are not working. And another one incident, he said, I was not ready for children, but you compel me to have children. So he blamed her for these two things, and he said he is feeling she stabbed him back. So she accepted that mistake. She's like, something wrong with me, I was focusing more on my children, that's why I didn't take care of her husband more. So as this result, they were separated for few days. And once another incident, once as a result of his abuse, she got back injury. But from that also, she didn't express that injury, that pain, back pain, nothing to him, because he may think her as a burden. And another, he realized she didn't tell and she's suffering. For that also, he blamed her. He is like, you are a careless person, not at all taking your health. So he blamed her. Then she was feeling bad about that. And another thing, her father also got married again. So she was like, not no place to live, not able to come away from husband also, not going to live with father also. And she felt no one is there on her side, and she's not able to leave her father also. But husband was forcing her to leave father and come, but she's like, at least someone should be there on my side, otherwise no safety. Her husband may abuse her more. So much anger towards husband and brother. She was trying to tolerate her brother also, but one day, lot of anger, some misunderstanding, she slapped him with a slipper. But it's a very rare incident. She expressed her anger, but mostly she suppressed her anger. She thinks she's so weak inside, so she feel lack of confidence to handle the situation. She has a lonely feeling, feeling low and inferior. Even she said, I'm feeling being like a victim, but she hates being in this situation. So I consider totality: guilt reproaching herself, feeling inferior, delusion as if beggar, feeling low, and sexual abuse, emotional abuse, anger suppressed, that so much anger is there, and yielding disposition, forsaken, feel no one there for her. System approach, we can make out it's a victim aggressor and a lot of sexuality issues are there. So it is animal kingdom, and we can sub kingdom mammals. Here lot of hierarchy, superior, inferior feeling, submissive, and safe with the group. If I'm with my father, I feel safe. With my husband, no security. And that forsaken feel is there. So I considered mammals and miasm, psychotic miasm, because she is accepting, lot of acceptance is there about her husband, about her situation, and mainly she feel something is wrong with me. I am incapable to handle. That internal weakness is there. So this psychotic miasm. And repertory in synthesis, I considered mind ailments from abused after being, and mind ailments from abused after being sexually, mind forsaken feeling, mind rage, mind yielding disposition, general allergic constitution. As a result, Natramur, Lacan, Sepia, Tuja, Lycochem. I referred Lacan in the Soul of Remedies. It feels inferior. The main theme in Lacan is dominance, feeling of low self-worth. They try hard to please, to be liked, cared for, and accepted because they feel left out and rejected. These feelings can sometimes be accompanied by a history of sexual abuse. She feels worthless, disgusted with herself, thinks she matters little, feels unimportant, like an untouchable. She blames others for her condition and can get angry with them for treating her the way they do. She can develop hatred and become revengeful, and lot of self-loathing. So I prescribed her Lacan 201 dose. Actually, this case, if you see level of experience, it is delusion level. We have to go for 1 but it is a skin case, so I considered maybe aggravation will happen if I directly give 1 so I gave her 200 and I gave minimum 1 dose because maybe aggravation also happened. So Lacan 201 dose. Jan 5th I prescribed, and Jan 8th she didn't get any new eruptions, but she started profuse urination and burning maturation started, but she used to get every time. She used to get only summer, but January she got this. So I thought it's a good sign of past complaint. And some upper respiratory complaints, cough with yellow expectoration came. So I repeated PL, and Jan 9th it became dry. And Jan 12th she didn't get any new eruptions. That eruptions are healing. And Jan 17th it's healed totally and no new complaints. This is that acute phase of her case. And if you after Jan 20, again she started new vesicles and she was angry. This time it is not because of onion or garlic she used any vegetable. She said I was angry the day before, and after that this complaints started. So I prescribed Lacan 1 dose, and she's using after this was I prescribed January and March. She's using onion and garlic, but eruptions not come every day, very rarely, and it disappear within a day, feeling much better in mind level. And even that ear allergy also she got only once after the medicine. And this is March. And June I asked her how is your complaint, everything. She said, I'm overall doing good. I often get triggered and boils show up. I remind myself it's because of past memory and present is safer. So the boils subside without much wounding. Actually, we have to repeat here 10 or 1 again, but she was away. She was not able to come and collect medicine. So I didn't prescribe. And she came on January this year. She said any past memories or any emotions, that time she's getting that vesicles, but it's going away without much wounding. So I prescribed her lac and tennum 1 dose. And this March, I asked her, she said, I didn't get any eruptions recently. Her mental state is better and she's living with her husband. She's able to express her emotions now. She's giving more importance to her emotions. And she said she's planning to consult a therapist. And her only stress is like she's thinking about her brother a lot. This is her case. Okay, I'm going to next case. This case, Mr. K, 39 years old male teacher, married from Tamil Nadu, February 2021. I took this case. He came with already diagnosed report with type 2 diabetes mellitus. In 2nd February, he had FBBS 250 milligram deciliter and PBBS 384 and HbA1c 10. And physical generals, desire salt, aversion meat, and sleep disturbed due to some dreams. And dreams he's not able to remember. Mostly due to dreams he's getting disturbed sleep. Get daily events in dreams. Speaking in stage. One particular dream he said he used to speak in stage. But after that in the dream he gets some prize also. So that happiness, what is his feeling, I asked in the dream. He said lot of happiness and proud about himself. And past history, no relevant history. Family history, his mother diabetic and she died due to complications of diabetic. That's why he came after blood investigation. He didn't start any allopathic treatment. He just he searched about other alternative medicine and she came to homeopathy. And father hypertensive, and personal history vegetarian. Actually his family everyone is non-vegetarian, but he has this aversion to meat, so he's a vegetarian, a non-smoker and non-alcoholic. And life space investigation, immediately he was talking about his mother. He said she was everything to me, I was completely dependent on her. She passed away recently. I am missing her very badly. No life in me after her death. And one particular thing he said about his mother is, it is very difficult to make decision nowadays. If my mother is around, she will perfectly explain everything. I just do whatever she says. And still some guilt is there. I didn't take care of her properly. She was also diabetic. That time I didn't think about any alternative medicine. I just consulted allopathy. So he has that guilt in him. And my father is a very strict person, angry person, and he have to follow his father's advice, instruction. Otherwise his father becomes angry. He used to beat him during childhood. Even now the patient 39 years old, if he want to buy anything, washing machine or fridge for house, anything, he should ask his father's opinion. Otherwise his father will get angry. He said to not to hurt his father's feeling. He just asked his opinion and follow that. And I have to go back home on time. Even if he's going home late in the evening, that time also his father get angry. So he's like every time he go, every day he be very alert. Even in 39 years old, he's thinking about his father and he's struggling, not able to being independent. And everyone up, he said in other people, neighbors or his friends, his colleagues, everyone, they appreciates me, they accepts me as talented person, but my father never appreciates me. During his marriage, this patient's marriage also, some issues happened. That time my dad hates my wife. Some from that incident his dad hates his wife, so even for that patient feel very bad. His mother already died, so we are only my father is there, so we are doing many things for him, but he never accepts and acknowledges us. And at least if he's not appreciating, that also fine, but his father go and tell his family, neighbors, everyone, like his patient is not doing anything properly. So when his father do that, I asked, what is your feeling? Patient said, I feel so insulted. He should talk to me directly. He thinks I don't know anything. And one incident happened in their home, that also his father went and told all the relatives and neighbors. Patient is feeling so much insulted. I'm doing everything for him, everything in his way, not to hurt him, but he is insulting me. And childhood, he worked very hard for his family. He took all the responsibility of his house, and he worked very hard to get government job. He was working in private school morning 9 to 6, and then he studied for exam to get government job. And nature, any bad words, if anyone is speaking bad words, he's a teacher, so in school also, if students they talk any bad words, or if he sees anyone is smoking alcohol, he gets very angry. And he said, I never drinks and smokes. So I asked why. He said, it will get some bad name for myself and my family, and others will think bad about myself and my family. So he said he's not at all drinking, or that is a issue. And he's very fastidious. In my observation, I saw, if I tell a time to come, if I fix the appointment, he come on time. um, and then if we give PL or anything, that also he take exactly. If I give 14 days, this is the my only patient, I think he just completely finish in 14 days and come again. So that much is very perfect order. And he said he enjoys speaking in public. He loved to do. The feeling is like everyone appreciate me after that. I love that appreciation. And he said in my school, he's working as a teacher. He said in his school, he's the only one who can speak on stage. So he always used read papers and some topics, and anytime he can go and talk, and he feel very proud about that. And the impact of diabetes on him, I asked. He said, I never tell to anyone, because if I tell others, they will think like I am suffering this condition at very early age, what they think about myself. So I am hiding this. And he said lot of anxiety is there, because his mother also died of complication of diabetes. So he's very restless and anxious about his health. So here lot of things, he's very dependent on his mother, and he needs someone for to take decision. He's lacking in many levels. So I consider mineral kingdom and row 3, because lot of care, nourishment, appreciation, image, what others think about me, lot of ego, insulted, pride, and recognized, and attachment with mother. So I consider this row 3. And mayasam, this especially this impact of diabetes on him, if we see, he has this anxiety and hiding from others. So from that, anticipation and hiding and covering, psychotic miasm. And synthesis, I referred some rubrics: ailments from grief, mind delusion, appreciated she is not, mind fastidious, remorse, responsibility, taking responsibility too serious, and food and drinks, meat aversion, salt desire, and general's diabetes mellitus. In result, natrum carcinosin and natrum sulf. So I referred all these remedies. In natrum sulf, in soul of remedies, I am scorned, disgraced, insulted, or not appreciated by the person with whom I have a relationship. And I must make a great effort to gain appreciation or to be valued by the other person. That appreciation is important, and insulted by the person whom I seek relationship. In order to be appreciated, this patient also very responsible, but he likes to speak in stage, but only to get appreciated. So that is there, and they like to be independent, but to maintain the relationship, they can be dominated or suppressed. And they have strong feelings of responsibility and guilt, and it's a psychotic remedy. After this reference, I prescribed him natrum self 10 weekly dose and LM8. But nowadays, I'm not prescribing weekly dose. That time, 2021, I was prescribing weekly dose and LM8. Now I give monthly dose, and whole month I give LM 50 millisiemen. And follow up immediately within a month. He did a blood checkup. He thought to do every month. So he did March. That time it came down 1 point. It became 9 HbA1c. So I advised him do 3 months once after that. Then June 2021, FBBS 150 milligram per deciliter and PBBS 284 milligram per deciliter, and HbA1c becomes 6. And then after that, he continued medication for some 2 months, 2 to 3 months, and then he didn't come for consultation, and he came on February. That time I told him to do an investigation. His HbA1c increased. It becomes 6.5. So I asked any stress factor or anything is there. He said he started a new company, new some part-time business like, but his father advised him not to do that. But anyway, he started. But his father not appreciating him nowadays. So here we can see some changes in patient. Before he do things only which his father appreciate or accept, but now he is able to do things but his father is not appreciating. That is his stress factor. So I prescribed him natrum self 1 4 dose BD and natrum self 0/6 OD. And this is, it become Feb, it was 10, and 2022 it becomes 6.5. After that, he didn't do any investigation. Even I advised him to do this month. Yeah, thank you everyone. Thank you Prana, Hope and Adasang Academy for this opportunity. Any doubts or anything?
Yeah, any doubts can be put on in the, any questions or doubts in the Q&A session.
Zero bar 6 OD means 50 millisimal we get 0 bar 1 to 0 bar 2, that 50 millisimal potency 0 bar 6, and in that OD once a day, only morning I used to give water dose. First case Asteria is plant, no Asteria. Are you Asteraceae plant family or Asteria? I need some clarification in this question.
Sanjay Rohra is asking, what book would you recommend for learning about that in-depth analysis?
Books, you can read Soul of Remedies and all Materia Medica and Case Taking Sensation in Homeopathy. Actually 200 and 1 potency I give dry dose, and this 50 millisimal I gave in water dose. Actually, why both millisimal and C potency? In first case, I didn't give 50 millisimal. In diabetic or hormonal, any chronic progressive cases, we have to, there is a need for remedy. So that type of cases, I used to give 50 millisimal potency. Yeah, you can refer structure book and John Scalton to understand remedies.
Hello.
Yes.
If I may say, Dr. Shruti asked for books on mammals or animal kingdoms. So Dr. Sankaran has already written books on mollusks and reptiles. For mammals, you can refer Dr. Massimo's work or books by Dr. Joshi's. Also, one Dr. Kalatia from Gujarat has written a book on animals. You can also refer those.
Yeah, Yogita asked how will you make water dose?
Some in a some 10 ml to 15 ml water, you have to add LM potency 2 or 3 within 10 poppy seeds. It be very minute, so you have to add within 10 poppy seeds and give that to the patient and tell them to take few drops of distilled alcohol also. It be preventive preservative for the medicine, and then you give that to the patient and tell them to take half tumbler water with that mix 10 drops from this liquid and take every day.
Archana Pawar is asking to differentiate between Asteria rubens with Laccan.
Asteria is a fish remedy, but here Lacan they have this hierarchy quality and this sexuality superior inferior, that things are there. So it is a mammal. It's exactly mammal.
So most of the questions, if there was fright in the case that stops coming out, then what would you look at plants? I think the question is not so clear.
And Vannam and yes, this 200 Vannam I didn't give same day. I tell them to take first 200 or Vannam, and then after 1 day or 2 days, then continue the LM potency.
Okay. Differentiation between lectin and Staphysagree, I think this is a question for you.
Yeah. Lacan is an animal remedy, but in Staphy, if you see, there will be lot of sensitivity and reactivity will be there. Patient have in ranunculacia, we can see that physical for a emotion they react physically, constriction in throat or any palpitation. Ranunculacia have very sensitive nerves kind of remedy. They have very sensitive, too much sensitivity will be there. So their reactivity will be too high. So here in this case, we are not seeing any sensitivity issues. Here issue is survival. So when we come to it is a kingdom, it is an animal kingdom. So no need to compare with Staffy. Staffy have that renunculacia theme. So there will be more of suppressing anger and that lot of withdrawn quality will be there. Lysinum is a lysinum also we can think in this case, but lysinum has a acute miasm and there will be lot of impulsiveness and suddenness. They behave like a lysin, that kind of quality they have. So lysinum is not appropriate for this remedy. Even I differentiated with lysinum because one incident she slapped his brother, no, so I differentiated with that. But lysinum has a very acute miasm quality, very suddenness and impulsiveness will be there. They will be very angry, rage and will be there.
So yeah, since most of the questions were answered, let's wrap it up for today. Thank
Yeah.
you, sir and ma'am, for sharing your experiences.
Yes, thank you everyone.
Thank you.